Are you waking up 2, 3, maybe even 4 times every night to use the bathroom? Look, if your sleep is constantly interrupted by urgent bathroom trips, and you never feel like your bladder is truly empty, I need you to pay close attention right now. You're getting ready for bed every single night anyway, correct? What if adding just a simple 5-minute routine before you turn off the lights could dramatically reduce those nighttime interruptions? I'm Dr. Grace Miller, a urologist with over 2 decades of experience helping men just like you reclaim their sleep and bladder control. Throughout my career, I've worked with thousands of men who thought constant nighttime urination was just something they had to live with. Here's what I've discovered. The most effective solutions aren't always medications or procedures. They're simple techniques you can do right at home. Today, I'm going to reveal the exact bedtime routine that helps men empty their bladders more completely, reduce nighttime bathroom trips, and finally, get the restful sleep they deserve. And before you dismiss this as another quick tip that won't work, understand that everything I'm sharing is supported by clinical research and proven techniques we actually teach in urology clinics. Even more important, these are practical methods that regular men have successfully used to cut their nighttime bathroom visits in half or more. Now, most people think the solution is just drinking less water before bed. And while that helps a little, it completely misses the real problem. The real issue isn't how much you're drinking. It's that your bladder isn't emptying completely when you go before bed. You might feel like you're done, but there's often 50 to 100 milliliters of urine still sitting in there. That's why you're up again in 2 hours. Your prostate is putting pressure on your urethra. Your bladder muscles aren't contracting as strongly as they used to, and that incomplete emptying? It's setting you up for a terrible night's sleep. What we need to do is create a proper emptying routine that actually works with your aging body's needs. Consider it like this. You wouldn't try to squeeze the last bit of toothpaste out without using the right technique, would you? Well, your bladder needs the same strategic approach, especially after 60. And here's the wonderful part. These techniques take just a few minutes and cost absolutely nothing. First technique, the double void method. First up, and this is the foundation of everything, the double void technique. This is hands down the most effective method for ensuring complete bladder emptying, and it involves urinating, then waiting 20 to 30 seconds and trying to urinate again. Here's what's absolutely fascinating about this technique. When you first urinate, your bladder contracts and releases most of the urine. But here's the problem. The muscles don't always contract evenly or completely, especially when your prostate is enlarged. There's almost always residual urine left behind. But here's where it gets really interesting. If you simply wait 20 to 30 seconds and make a second attempt, your bladder muscles have time to reset and contract again. This second void often releases a surprising amount of additional urine that would otherwise wake you up in an hour or two. The key is to focus on relaxing your pelvic floor muscles during that 20 to 30 second waiting period. Don't force anything. Don't strain. Just stand there, or sit there, breathe deeply, and let your muscles completely relax. Here's a trick that works remarkably well. During that waiting period, run your hands under warm water. The warmth and the sound of running water triggers a natural relaxation response in your pelvic floor muscles. It's like giving your bladder permission to release that last bit. Studies on double voiding show that it can reduce residual urine volume by 50% or more. That's the difference between waking up once versus 3 times per night. That's the difference between dragging through your day exhausted versus actually feeling rested. Most men tell me they're shocked at how much more comes out on that second attempt. The first few times you try this, you'll probably be amazed. You thought you were empty, but your bladder had other ideas. The timing matters too. Don't rush it. 20 to 30 seconds feels longer than you think when you're standing at the toilet. Count slowly to 30, or use that time to wash your hands thoroughly. Make it part of your routine so you don't skip the waiting period. Second technique, the optimal sitting position. Now this next one might surprise you, and some men resist it at first. But hear me out. Sitting down, especially at bedtime, dramatically improves complete emptying. I know, you've been standing your whole life, But here's the science that will change your mind. When you stand as you get older, gravity and your body position actually work against complete emptying. The angle combined with natural pressure from aging creates resistance that prevents full drainage. When you sit down properly, everything changes. Your lower muscles can fully relax, the angle straightens out, and your body can work more efficiently. Studies have shown that men who sit have significantly less remaining, especially after age 60. But here's the critical part. You have to sit correctly. Don't just plop down. Here's the proper technique. Sit all the way back on the seat. Keep your feet flat on the floor about shoulder width apart. Lean forward slightly from your hips, not your waist, and let your elbows rest on your knees. This forward lean is crucial. It reduces pressure on your lower body, allows your stomach muscles to assist with emptying, and creates the optimal angle for complete drainage. Think of it like you're reading something on the floor in front of you. Now take your time. Don't rush. Breathe slowly and deeply. Let your stomach muscles relax completely. Many men unconsciously tense their midsection, which actually prevents complete emptying. You want everything loose and relaxed. Here's something most men never consider. When you stand, especially at night when you're half asleep, you're often tensing muscles without realizing it. You're trying to balance. You're trying to aim. You're not fully relaxed. All of that tension prevents optimal emptying. Sitting eliminates all that tension. You can close your eyes, breathe deeply, and let your body do what it needs to do without any interference. Some men tell me this sitting position alone reduced their nighttime trips from 3 times to just once. Third technique, the rock and relax method. Here's the third technique, and this one gently helps your body complete the process with ease. It's called the rock and relax method. It's a simple seated motion that supports your body's natural rhythm. Here's how to do it. Once you're done and still sitting, slowly tilt your hips forward, arching your lower back just a little. Hold for 2 seconds. Then tilt backward, rounding your lower back slightly, and hold again for 2 seconds. Repeat this gentle rocking motion about 5 to 10 times. This subtle movement helps create small pressure shifts in your lower body, allowing everything to settle comfortably. Think of it as giving your system a soft assist from different angles. To make it even more effective, after your final forward tilt, lean forward slightly. Bring your chest closer to your knees, and take a deep, calm breath in. As you breathe out, relax your lower body, and allow your body to finish the process naturally. Many men are surprised at how effective this feels once they try it. The body has small folds and spaces where things can sometimes stay in place, and this simple rocking helps everything flow better. The most important part is to stay relaxed, no forcing or straining. Let the movement feel light and easy. You're simply working with your body, not against it. Clinical research has shown that gentle, consistent movements like this can reduce discomfort and improve daily comfort over time, often within just a few weeks. This rock and relax technique is a simple, natural way to support your body's complete rhythm. Fourth technique, the suprapubic pressure method. Now here's one that sounds technical but is incredibly simple and effective. Suprapubic pressure. That's just fancy medical talk for gently pressing on your lower abdomen to help empty your bladder completely. Here's exactly how to do it. After you've urinated and done your double void, place your hand flat on your lower abdomen, about 2 to 3 inches below your belly button. This is right where your bladder sits. Apply gentle, steady pressure with your palm, pushing down and slightly back toward your spine. Hold that pressure for about 5 to 10 seconds while you try to urinate again. You're essentially helping your bladder muscles do their job by providing external assistance. It's like helping squeeze the last bit from a nearly empty bottle. But here's the important part. The pressure should be firm but gentle. You're not trying to crush anything. Think of it as the same pressure you'd use to check if bread dough has risen properly. Firm enough to create compression, but gentle enough to be completely comfortable. Some men find it helpful to use a slow, massaging motion rather than constant pressure. Start at the top of your bladder area and slowly press downward in small circles, working your way down toward your pubic bone. This helps push urine from all areas of the bladder toward the urethra. This technique is especially effective for men with weakened bladder muscles. As we age, the detrusor muscle, that's the main bladder muscle, loses some of its strength and coordination. External pressure compensates for that weakened contraction. Many men tell me this technique alone releases an additional tablespoon or two of urine they thought wasn't there. That might not sound like much, but that's exactly the amount that would wake you up an hour or two after falling asleep. Fifth technique, the strategic timing sequence. Last, but absolutely critical, the strategic timing sequence. This is about when you do your bedtime bathroom routine relative to everything else in your evening. Most men get this completely wrong, and it sabotages all their other efforts. Here's the mistake most men make. They brush their teeth, wash their face, change into pajamas, then go to the bathroom right before climbing into bed. The problem with this sequence is that all that moving around after your bathroom visit can cause urine to shift and redistribute in your bladder. Here's the optimal sequence that actually works. About 45 to 60 minutes before your target bedtime, stop drinking all fluids. Any fluids, even small sips of water. Your kidneys need time to process what you've already consumed. 30 minutes before bed, do all your physical activities. Brush teeth, wash face, change clothes, set out tomorrow's clothes, whatever your routine involves. Get all the movement done. Then, 10 to 15 minutes before you actually get into bed, do your complete bladder emptying routine. Sit down. Use proper position. Do the double void. Use the pelvic rock. Apply suprapubic pressure if needed. Take your time and do it thoroughly. After this final bathroom visit, go directly to bed with minimal movement. Don't walk around the house checking locks, don't go to the kitchen for water, don't do any additional tasks. The goal is to keep your body as still as possible so urine doesn't redistribute. Here's why this timing matters so much. Your bladder continuously produces urine, obviously, but the rate slows down significantly when you're lying still and your body enters rest mode. By doing your complete emptying routine right before bed, you're giving yourself the maximum possible time before your bladder fills again. Studies on bladder training show that timing and consistency are just as important as technique. Your body responds to patterns and routines. When you follow the same sequence every night, your bladder actually learns to cooperate better with the emptying process. Now you're probably thinking, am I supposed to spend 20 minutes in the bathroom every night? Not at all. Here's how to make this work in real life without it becoming a burden. Start with just one technique. I recommend beginning with the double void method because it's simple and delivers immediate results. Practice that for 1 week until it becomes automatic. Week 2, add the sitting position if you're not already doing it. Focus on proper posture and relaxation. By week 3, you'll barely think about it. Week 3, incorporate the pelvic rock technique. It only adds 30 seconds to your routine. Week 4, experiment with suprapubic pressure and dial in your timing sequence. Here's the realistic, practical routine that works for most men. 45 minutes before bed, stop all fluids. 30 minutes before bed, complete your evening tasks and hygiene. 10 minutes before bed, go to the bathroom. Sit down in proper position. Urinate normally. Wait 30 seconds while relaxing. Urinate again with double void. Do 5 to 10 pelvic rocks. Apply gentle suprapubic pressure. Attempt one final void. The entire bathroom portion takes 2 to 3 minutes once you're practiced at it. That's it. 3 minutes for potentially hours of uninterrupted sleep. Don't force or strain during any of these techniques. If something causes discomfort or pain, stop immediately. These should all feel natural and easy. Don't expect perfection on night 1. Your body needs time to adapt to new patterns. Give it at least 2 weeks of consistent practice before evaluating results. Don't eliminate all evening fluids too early. Stopping fluids 45 to 60 minutes before bed is sufficient for most men. Stopping too early can lead to dehydration, which causes other problems. And don't ignore underlying issues. If you're waking up more than twice per night, experiencing pain or burning, or seeing blood in your urine, see your urologist. These techniques really optimize normal function, but don't treat serious condition. Your 30-day action plan. Here's your exact roadmap. Start with the double void technique only. Every night for 1 week, practice urinating, waiting 30 seconds and urinating again. Week 1, just double voiding. Track how many times you wake up each night. Write it down. Week 2, add the sitting position and proper posture. Continue double voiding. Track your nighttime wake-ups. Week 3, incorporate the pelvic rock technique after your double void. Track your results. Week 4, add suprapubic pressure and optimize your timing sequence. By now, the routine should feel completely natural. Document your experience. How many times are you waking up per night? How well rested do you feel in the morning? Are you sleeping through larger blocks of time? Rate your sleep quality 1 to 10 each morning. I'm confident you'll notice significant improvement within 2 weeks. Most men who consistently use these techniques reduce their nighttime bathroom trips by 50% or more within the first month. And if you're ready to fully commit, use all 5 techniques together as one complete bedtime routine. The timing sequence, the sitting position, the double void, the pelvic rock, and the suprapubic pressure. Every single night for 30 days. The complete cost is $0. The potential return? Finally getting the deep, uninterrupted sleep you desperately need. Listen, you don't have to accept waking up multiple times every night as inevitable aging. Your bladder can function better with the right techniques. These aren't complicated medical procedures. They're simple, proven methods that work with your body's natural functions. These techniques cost nothing, take just a few minutes, and are backed by urological research and clinical practice. This is what we actually teach patients in our clinics. And now you have access to the same information. So tonight, before you go to bed, remember what we discussed here. Remember that you have the power to dramatically improve your sleep quality with just a few simple techniques. Your body is still capable of better bladder control. Sometimes it just needs the right approach. I genuinely want to hear from you. Leave a comment telling me how many times you're currently waking up per night to use the bathroom. I'm truly curious about where you're starting from. And after you try these techniques for a week or 2, come back and share your results. Your experience might inspire another man to finally get the sleep he needs. If this information provided real value, click that subscribe button for more practical urological advice for men over 60. No embarrassment, no judgment, just proven solutions that genuinely work. And please, share this with a friend or family member who's struggling with nighttime urination. Until next time, this is Dr. Grace Miller reminding you that better sleep is possible, and small changes in technique create massive improvements in results. Take excellent care of yourselves.